this video, I'm going to be telling you what you can expect from the future of the legal drug market industry. Think about how much sales there's going to be for cannabis distribution. People want cannabis more than they want alcohol, tobacco, and prescribed pharmaceuticals. People are demanding that, and the money being made off of that is going to a good cause because people are treating their self with medicine, and it's been shown to be so useful for so many things. And the future of the legal drug market industry will be centered around cannabis distribution. I'm surprised only 11 US states have legalized recreational, because it only makes sense to legalize it for recreational if you have a certain age restriction on it, because maybe it affects the development of the mind, or maybe what effects are experienced are short term, but whatever cannabis does and long-term use can be seen. You've seen the results. You know what to expect. Time has told us that. Think about it. We can backtrack cannabis use over so many years. But what about those pharmaceuticals that they're prescribing? Like, whatever it is, you're basically just their guinea pig to test stuff out with. And I know they're never going to outlaw that dextromethorphan chemical because there's too much money being made off of a drug that has been legal for decades. Since the late 1950s, they've had dextromethorphan legalized for treating cough reflux, and it works effectively, and it has garnered a brand name, Robitussin, or say Delsum, or say whatever the name of the brand is. They are making so much money off of dextromethorphan products, and especially with the RoboCough that they're selling. So why would the government be so stupid to try to outlaw something that they're going to make so much money off of? As long as it's regulated by the FDA, which dextromethorphan is, that tells you that the dextromethorphan is always going to be over the counter. Now, they'll put restrictions on it, like you would have to be 18 or older to buy it in certain places, or maybe 21 or older to buy it in certain places, depending on the place, wherever the location is. But that dextromethorphan has made too much money for the government, and that is why it's being regulated. And that RoboCough product is back in business. They're selling like crazy. They are filled to the brim with so much RoboCough, and the government is in on making sure dextromethorphan is distributed alongside cannabis, because cannabis has taken over the legal drug market industry revenue. Like, the revenue that would normally be from people spending money on alcohol or tobacco is now going to be spent on RoboCough and cannabis. This is the future of the legal drug market industry. It's the way it was meant to be, and it was planned for a long time, and it's been planned for such a long time, and now it's really being put into effect. People are opening up, their perception with legal, dissociative, FDA approved cough medicine, because It's for the purpose of cough relief. That is why they prescribe the product. Well, they don't even prescribe it. You prescribe yourself cough relief. And the fact that you spend so much money for that chemical means there's so much money to be made. It would only be illogical to try to outlaw such a popular product that's been around for decades, because then people will wonder, well, how is it that dextromethorphan has been around for decades, since the late 1950s? Because they could not find an alternative that worked as effectively for cough relief. It did its job. It works like a charm for cough relief. And it also is being used for pseudo-bubbler effect. Think about those people that have uncontrollable laughter and crying syndrome. Think about the kind of shit that they have to go through. They don't have control over that. Think about how, like, the social situations would be for them when they're having uncontrollable laughter or crying. They have to have new Dexta, which is dextromethorphan mixed with quinidine to enhance the bioavailability